Navigating the winter landscape, understanding and preventing common seasonal illnesses. Winter, with its frosty embrace and shorter days, brings a unique set of challenges to our health. While the season can evoke images of cozy evenings by the fire and the enchantment of snow-covered landscapes, it also brings with it an increased risk of the shift in weather patterns, coupled with changes in our behavior, creates an environment where various viruses and bacteria can thrive, often leaving us feeling under the weather. Understanding these common winter illnesses, their causes, and effective prevention strategies is crucial for maintaining our well-being and navigating the colder months with health and vitality. This isn't just about avoiding a few days of discomfort. It's about safeguarding our overall health and ensuring that we can fully enjoy all that the winter season has to offer. The reduced temperatures and lower humidity of winter can have a significant impact on our bodies. Cold, dry air can irritate and dry out our mucous membranes, those protective barriers in our noses, throats, and lungs, making it easier for pathogens to enter. Furthermore, we tend to spend more time indoors, often in close proximity to others, which can increase the risk of transmission of respiratory illnesses. This combination of factors creates a perfect storm for the spread of various viruses and bacteria that thrive in colder, drier conditions. Furthermore, our reduced exposure to sunlight during the winter months can lower our vitamin D levels, which is crucial for immune function. These changes to our external environment, combined with lifestyle changes, can often lead to a higher rate of seasonal illness. Let's embark on a comprehensive journey through the common illnesses that tend to rear their heads during the winter season, exploring their causes, symptoms, and, most importantly, practical and effective ways to prevent them. This isn't just about memorizing symptoms. It's about empowering ourselves with the knowledge to make informed choices, to take proactive steps to safeguard our health, and to navigate the winter months with confidence, strength, and well-being. We will delve into the science behind these illnesses, understanding the intricacies of their transmission and how our bodies react to them. We will also explore effective preventive strategies, from simple lifestyle modifications to more targeted interventions, offering a comprehensive guide to staying healthy throughout the winter season. The respiratory assault. Common winter illnesses of the airways, the respiratory system, the pathway for air into and out of our lungs, often bears the brunt of winter's assault. Respiratory illnesses are among the most common ailments during this time of year, and they can range from mild inconveniences to more serious conditions. The common cold, a frequent winter visitor. The common cold, caused by a variety of viruses, is one of the most frequent illnesses we encounter throughout the year, but it is particularly prevalent during the winter months. The symptoms, though generally mild, can be quite disruptive, including a runny nose, sneezing, sore throat, cough, and congestion. While a cold typically resolves on its own within a week or so, it can still leave us feeling tired, uncomfortable, and unable to fully enjoy our daily activities. There's no cure for the common cold, but there are ways to manage the symptoms, including rest, hydration, over-the-counter pain relievers, and decongestants. Preventing the spread of colds is crucial. Washing your hands frequently, avoiding close contact with those who are ill, and covering your mouth when coughing or sneezing can make a big difference. Influenza, the flu, a more formidable foe. Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. It's often more severe than the common cold, with symptoms that can include fever, chills, body aches, headache, fatigue, and a persistent cough. Unlike a cold, the flu can sometimes lead to serious complications, such as pneumonia, especially in young children, older adults, and individuals with underlying health conditions. The flu virus is constantly changing, making it difficult for the immune system to develop long-lasting protection. Therefore, vaccination is the best way to protect yourself against the flu. Annual flu vaccines are recommended for most individuals over 6 months old, and they are designed to target the most prevalent strains of the virus for that year. Practicing good hygiene and avoiding close contact with sick individuals can also help prevent the spread of influenza. Bronchitis, inflammation of the airways. Bronchitis is an inflammation of the bronchial tubes, the air passages that carry air to and from the lungs. It can be caused by viral or bacterial infections, and it often develops after a cold or flu. The main symptoms of bronchitis include a persistent cough, often accompanied by mucus, chest discomfort, and fatigue. Acute bronchitis typically resolves within a few weeks, but chronic bronchitis, which is more common in smokers, can persist for months or even years. Treatment for bronchitis usually involves rest, hydration, and managing the symptoms. Although in some cases, antibiotics may be necessary for bacterial infections. Preventing bronchitis involves avoiding exposure to respiratory irritants, such as smoke and pollutants, as well as avoiding close contact with sick individuals. Pneumonia, a serious lung infection. Pneumonia is an infection of the lungs that can be caused by viruses, bacteria, or fungi. It can range from mild to severe, and it can be life-threatening, especially in young children, older adults, and those with compromised immune systems. The symptoms of pneumonia can include a cough, often with mucus, fever, chills, chest pain, and shortness of breath. Treatment for pneumonia depends on the cause, but it usually involves antibiotics for bacterial infections or antiviral medications for viral infections. Vaccination against pneumococcal pneumonia is also recommended for certain high-risk individuals. Preventing pneumonia involves practicing good hygiene, avoiding smoking, and ensuring you have strong immunity. Sore throat and strep throat, irritation and infection. A sore throat is a common symptom of many respiratory illnesses, including colds and the flu. However, a sore throat can also be caused by a bacterial infection known as strep throat. Strep throat is caused by the bacteria Streptococcus pyogenes, and it can be more severe than a typical sore throat, with symptoms that include a painful sore throat, difficulty swallowing, fever, and sometimes swollen lymph nodes in the neck. Strep throat requires treatment with antibiotics to prevent potential complications, such as rheumatic fever. Getting a rapid test for strep throat when experiencing severe throat pain is essential to ensure proper treatment and prevent complications. 2. The immune system under siege. Other common winter ailments. Beyond the respiratory system, other parts of the body can also be vulnerable during the winter months, and certain illnesses can be more common. Norovirus, the stomach flu, a gastric intruder. Norovirus, often referred to as the stomach flu, is a highly contagious virus that causes gastroenteritis, an inflammation of the stomach and intestines. It's more prevalent during the winter months, often affecting entire communities or groups of people. The symptoms of norovirus include nausea, vomiting, diarrhea, stomach cramps, and fever. The illness typically resolves within a day or two, but it can be quite unpleasant while it lasts. Preventing the spread of norovirus is critical. Washing hands thoroughly and frequently, especially after using the bathroom and before eating, and disinfecting surfaces can help to stop its spread. There's no specific treatment for norovirus, but it's important to stay hydrated and get plenty of rest. Skin dryness and eczema. The winter itch. The cold, dry air of winter can have a significant impact on our skin, leading to dryness, irritation, and exacerbations of eczema, a common skin condition that causes red, itchy patches. The lack of humidity in winter can dry out our skin, causing it to become rough, flaky, and itchy. Using moisturizers, avoiding harsh soaps, and taking lukewarm showers can help to prevent dry skin and manage eczema flare-ups. Keeping skin hydrated is essential for comfort and overall health. Seasonal affective disorder SAD. The winter blues. Seasonal affective disorder SAD is a type of depression that occurs during the fall and winter months when there is less sunlight. The symptoms of SAD include fatigue, decreased energy, changes in appetite, difficulty concentrating, and feelings of sadness or hopelessness. The lack of sunlight can disrupt the body's natural sleep-wake cycle, affecting the production of hormones that regulate mood. Treatment for SAD can include light therapy, which involves exposure to bright, artificial light, as well as therapy and medication. Recognizing the symptoms and seeking treatment are essential for managing SAD and improving overall well-being. Cold sores, a recurrent viral outbreak. Cold sores, also known as fever blisters, are small, painful blisters that typically occur on or around the lips. They are caused by the herpes simplex virus type 1 HSV1. The virus can remain dormant in the body, and outbreaks can be triggered by various factors, including stress, illness, and exposure to cold or sun. While there is no cure for cold sores, antiviral medications can help to shorten the duration of outbreaks and reduce the frequency of recurrence. Raynaud's phenomenon, cold-induced vasoconstriction. Raynaud's phenomenon is a condition that causes decreased blood flow to the fingers and toes. TYPICALLY in response to cold temperatures or stress. The symptoms include numbness, tingling, and color changes in the fingers and toes, which can become white, blue, or red. In severe cases, Raynaud's can cause pain and discomfort. Keeping your body warm, particularly your hands and feet, can help to prevent Raynaud's episodes. Avoiding smoking and managing stress can also reduce their frequency and severity. 3. Prevention is key. Strategies for a healthy winter. While winter illnesses can seem inevitable, they are often preventable. By taking a proactive approach, we can strengthen our body's defenses, minimize our exposure to pathogens, and navigate the winter months with health and vitality. Vaccination, a shield against illness. Getting vaccinated against the flu and other respiratory illnesses, such as pneumonia, is one of the most effective ways to protect yourself from contracting these diseases. The annual flu vaccine is designed to target the most prevalent strains of the virus for that year, and it can significantly reduce your risk of getting sick. Vaccination not only protects you, but also contributes to the overall health of the community by reducing the spread of infectious diseases. Hand hygiene, the cornerstone of prevention. Washing your hands thoroughly and frequently, especially after touching public surfaces, using the restroom, and before eating, is one of the most important things you can do to prevent the spread of illness. Use soap and water and scrub for at least 20 seconds. When soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol. Respiratory etiquette, protecting those around you. Covering your mouth and nose with a tissue when you cough or sneeze, and then discarding the tissue immediately, is crucial to prevent the spread of respiratory illnesses. If you don't have a tissue available, cough or sneeze into your elbow, not your hands. Avoid close contact, creating a buffer. Limiting close contact with people who are sick is another key preventive strategy. When possible, maintain a safe distance of at least 6 feet from those who are coughing or sneezing, and avoid touching your face, especially your eyes, nose, and mouth, to prevent pathogens from entering your body. Strengthening your immune system, the internal defense. Prioritizing a healthy lifestyle is crucial for maintaining a strong immune system. This includes eating a nutritious diet rich in fruits, vegetables, whole grains, and lean proteins. Getting adequate sleep, managing stress levels, and engaging in regular physical activity are also essential for keeping your body strong and resilient throughout the winter months. Maintaining humidity, protecting your airways. Using a humidifier in your home can help to combat the dryness of indoor heating, which can irritate and dry out your mucous membranes. Keeping your airways moist can help to prevent pathogens from entering your body. Proper hydration, essential for all body functions. Drinking plenty of water throughout the day is important for keeping your body hydrated and healthy. Staying hydrated helps to thin mucus, making it easier to cough it up. And it also supports the immune system. Vitamin D supplementation, filling the gap. Consider taking a vitamin D supplement during the winter months, especially if you live in a region with limited sunlight. Vitamin D plays a vital role in immune function, and supplementation can help to fill any deficiencies. Seeking medical advice, knowing when to act. If you experience symptoms of illness that are severe or persist for more than a few days, it is important to seek medical advice. Early treatment can help to prevent complications and ensure a faster recovery. Conclusion: a winter of health and well-being. The winter season may bring an increased risk of certain illnesses, but by understanding their causes, practicing effective prevention strategies, and prioritizing our health and well-being, we can navigate the colder months with strength, vitality, and joy. Prevention is not merely about avoiding illness. It's about embracing a proactive and empowered approach to health, ensuring that we can fully participate in all that this season has to offer. Let us commit to making mindful choices, to prioritize our well-being, and to move through this winter season with confidence, resilience, and a deep appreciation for our health. We are not merely surviving the winter months, we are thriving, empowered by knowledge, committed to well-being, and connected by the shared experience of this season.